Now we'll be looking more into the Pfizer's announcement at 11 o'clock. Dr. John Swartzberg with UC Berkeley School of Public Health will be joining us to help us better understand the COVID vaccine for children. Happening right now, we're going to take you out live to Concord, where health officials are talking about the opening of the drive-through vaccination clinic over at Hurricane Harbor. Let's listen in.
To lead us to the other side of this pandemic. The county will be working here alongside our great partners, Kaiser Permanente and the City of Concord. And as we recognize those who made this possible, I want to offer a special thank you to County Supervisor Karen Mitchoff, who represents this area, in helping make this site come to fruition. This new drive-through vaccination site here in Concord is going to get us to our post-pandemic destination faster. So we ask people, wear your masks, gather outside if you get together with people outside your household, maintain distance between you and others. In addition to our partners here today, we want to thank the National Guard, and we want to thank Six Flags Hurricane Harbor for the support that they are offering. So, if you live or work in Contra Costa County, sign up now on the website cchealth.org or call 883-VAX-COCO. Now I'm going to turn it over to Chris Boyd.
Thank you, Supervisor Burgess. I'm Chris Boyd, B-O-Y-D.
How do you spell Chris?
C-H-R-I-S.
Thank you.
Kaiser Permanente welcomes this opportunity to be working with Contra Costa Health Services and the City of Concord to open this vaccination site. The goal of the site is to continue to add to the broader solution for vaccine access and increasing capacity in Contra Costa County. The health and safety of our members and the communities we serve is our top priority. Kaiser Permanente has decades of experience delivering vaccinations both safely and efficiently, strictly following public health and medical guidance, and this opportunity helps us increase our capacity to deliver more vaccine doses. Kaiser Permanente will have the capacity to provide as many as 2,000 daily appointments at this clinic once the site is fully operational, with appointment availability being dependent on our receiving enough vaccine supply. We look forward to this partnership, and as we receive more vaccine, we can continue to get it into the arms of our members and our communities at our Kaiser Permanente facilities and at sites like this. I'll now turn it over to Mayor Tim McCallion.
All right, good morning, everyone. My name is Mayor Tim McCallion from the City of Concord, spelled T-I-M. Last name is M-C-G-A-L-L-I-A-N. And I would like to, again, welcome everyone to the City of Concord. As the largest city in Contra Costa County, Concord is honored to be able to host a site such as you're going to see behind us. We're so glad that we can serve everyone throughout the county and make this such a huge opportunity for everyone to be able to get their vaccine. Well, it's unfortunate that Hurricane Harbor has to temporarily be closed. We are so fortunate that we can also use this site, this venue, to be able to help people with this drive-through site to be able to get this life-saving vaccine. I want to also commend the county for the speed in which they have been able to distribute the vaccine in Contra Costa County, and incredibly proud that the county is the first in the state to be able to accomplish to get to that point so that everyone 16 and older is eligible for the vaccine. Thank you to our Contra Costa Health officials for working so diligently and collaboratively with all the cities and partners in order to make this a reality. We want to continue to encourage people to get their vaccination now as soon as possible, and that we know that this is something that will make the hugest difference in our community. We want to make sure that everyone is aware that, of course, we have programs such as Help Your Neighbor, and you can go onto the Contra Costa County website to be able to sign up, help your friends, help your family, and in some cases, parents, help your older children, now 16 and over, to be able to sign up, to be able to get their vaccine. I also want to thank this incredible partnership between Kaiser Permanente and the thousands of people that are now able to get their shot, and in partnership with the county, and of course, many members within the City of Concord who've been able to make this possible. So now I'd like to go ahead and turn it over to Dr. Gruyan from Kaiser.
Thank you, Mayor McGallion. My name is Dr. Ken Grullon, K-E-N-G-R-U-L-L-O-N, and I'm the physician-in-chief of the Diablo Service Area. Kaiser Permanente spans from Walnut Creek to Antioch and all the surrounding areas. Everyone deserves the opportunity to be vaccinated to help protect them from COVID-19, and we are committed to administering vaccines equitably according to federal, state, and county guidelines. We are committed to providing the COVID-19 vaccine to eligible people as quickly and equitably as possible based on the supply we receive. And thank you so much to Contra Costa County for contributing significant amounts. And we're using the power of our integrated system to support the communities most affected by COVID-19. As crucial vaccine supplies begin to increase, it is vitally important that the public feel confident in the safety of the vaccines and are willing to be vaccinated, particularly in communities most affected by the pandemic. As an aside, as a physician and a Latino male, I'm fully vaccinated. My wife just received her first vaccine, and my 19-year-old daughter is eagerly awaiting her opportunity. We are actively working to educate our members, workforce, customers, and communities about the safety and effectiveness of the vaccines and to promote understanding of how a vaccine, coupled with continued public health measures like wearing of masks, appropriate physical distancing, and frequent hand washing, can help control and ultimately bring around the end of the COVID-19 pandemic. We see the light at the end of the tunnel. Let's keep up all those measures. Kaiser Permanente has always had a deep commitment to health equity, and we are ideally positioned to help reduce health disparities during and after the COVID-19 pandemic. We see this large-scale vaccination site as a great opportunity for our community to be empowered and to protect themselves and others by getting vaccinated when it's their turn. Would love to see you here. And right now, I will pass it on to Dr. Ori Zavelli, the County Health Officer. Thank you.
Hello, my name is Ori Zavelli. First name O-R-I, last name T like Tom, Z like zebra, V like Victor, I like India, E like Echo, L like lemon, I like India. We promised our community we would open a large-scale vaccination site once we have had enough vaccine, and that day has come. We are now at a place where vaccine supply is starting to meet or even exceed demand. We are moving fast, but in a thoughtful way, with an eye on equity. We are removing barriers, eliminating confusion and uncertainty that comes with the eligibility criteria, piloting walk-in clinics so people can go when they have the time. We will continue to prioritize appointments for patients in the lowest quartile of the Healthy Places Index. We continue to do mobile clinics, increasing the number of doses at these clinics by as much as 4-fold. In January, we set a goal of vaccinating, of getting 1 million doses into arms by July 4th, and last week, we moved that up to Memorial Day. We're confident that we will meet that goal, and maybe even sooner. We are fortunate to have 3 safe and effective vaccines against COVID. I urge everybody to get vaccinated when it's their turn. I've already been vaccinated myself. These vaccines are our strongest tool to end the pandemic. Today is a good day. I'd like to hand it back over to Kim McCarl.
All right, if you have questions and you want to tell me specifically who you have the question for, where should we start? Yes, over here.
How early in the morning can they get in line over here to where they got to get to work?
Dr. Zavelli, you want to talk a little bit about logistics?
Our appointments start at about 7:45 and go throughout the rest of the afternoon. I think the last appointment is at about 3:30 or 3:45. We're asking people to come at their appointment time and not to line up early so that we don't back up the traffic, and that way we continue to have a smooth traffic flow throughout the day. That's a good question. Most people can get through within 30 to 45 minutes. We trust people to self-attest. On the county side, we trust people to self-attest when they sign up on our vaccine form and self-certify that they live or work in Contra Costa County. I don't know about Kaiser, if you want to talk about how you approach it.
Yeah, as Kaiser Permanente, we know exactly who our members are and where they live through their health record, so that's how we're administering. We both have, we actually have separate systems for sign up. Kaiser Permanente, we sign up through My Doctor online or our own website, so that's how we check. And we do have separate lanes, and people are checking at the front to decide who goes where.
Lori, will you talk a little bit about how important it is to have an appointment? People can't just show up.
Yes, although we are piloting walk-in sites at some of our other vaccination sites starting next week, and we'll have more about that starting next week. At this site, our drive-through site, it's very important that only people who have an appointment come, because otherwise our traffic gets backed up and it becomes a mess. So here it's really by appointment only, and for the county appointments, you go to cchealth.org, fill out an interest form, and you'll get an appointment ticket. We are using all three vaccines. The majority of what we have here at this site is Pfizer and Johnson & Johnson or Janssen vaccine. But we are using all three vaccines, and depending on what is allotted to us by the state and federal sources, it may be different vaccines on different days. When you come, if you are slated to receive a 2-dose vaccine like the Pfizer, then when you come through and get your first shot, they'll immediately give you your follow-up appointment for your second dose. We are ratcheting up. So this week we're starting between Kaiser and county doses. We're at about 1,500 to 2,000 a day. By next week we expect to be at about twice that. So somewhere between 12,000 and 16,000 doses a week. Since we opened up our eligibility for 16 and over for anyone who lives or works in Contra Costa County, we've had huge demand. Our phones have been ringing off the hook. We had over 30,000 people sign up for appointments overnight, and more are coming in. That's great. We want people to sign up. We want people to be patient with us because demand is very high. It might take us a few days to get back to you. But more appointments do open up. Each day we open up thousands of more appointments, so we will get to you. And if you're patient, you should be getting an appointment within the next few weeks.
So, or if you'll reiterate, 16 to 49 with cchealth.org only.
That's right, 16 to 49 with cchealth.org only. My turn will add that eligibility on April 15th, but for now, that's only at cchealth.org. We know that there's about 375,000 people who live in Contra Costa County in that age group that have yet to receive the vaccine. We're hoping that all of them come through. In reality, I think about 80% or so are choosing to get vaccinated. Good thing is that the vaccine hesitancy that some people have, they wanted to make sure this was safe and effective, is going down. More people are trusting the vaccine. More people are seeing how effective it is, how safe it is, that really there's very few adverse effects or allergic reactions. So we're hoping that all of those people come through and get vaccinated. I think it will trickle in over time, and we just had good news today on the Pfizer vaccine that the studies are coming out that it's also safe and effective for ages 12 to 15. So that's not approved yet by the FDA, but in the next few weeks we expect that approval to come through, and we'll be able to open up to the younger age group when the FDA says it's okay.
I think we had a question right here.
We have not done an analysis of vaccination rates versus voting patterns. Great question. We have a observation area where we observe people after the vaccine, and there's medical personnel, including emergency personnel, available to give them treatment right away. We also do a pre-screening before we give the shot to make sure that they're not allergic to any components of the vaccine. So we've had very few adverse reactions. We've vaccinated we've put in over 600,000 doses in the county, and I can just tell you how amazingly safe and effective this has been. Really one of the best vaccines or sets of vaccines made in modern medical history.
Hey, Ori, Supervisor Burgess has a comment she'd like to make.
Yeah, I just want to clarify that when you go on cchealth.org, what you're doing is getting in line. You may not get your appointment right away, but we have a system that can accommodate you saying, I'm interested, I want to get my vaccine, and then you're in line. And so we've been able to turn that over. So 30,000 people last night, we'll be able to get through that just in a couple days of, getting to people. So I just want people to know that when you go on cchealth.org, you're getting in line. So I want to encourage everybody to get in line. And like Mayor said, if you have someone in your life, someone you know that hasn't signed up, either they're hesitant or they don't feel comfortable with technology or they just haven't done it yet, help them. Help them get signed up.
The thought process behind opening up our eligibility to everyone 16 and over was really simple. We had appointments that were at risk of not being filled, and we wanted to fill them. We knew we would get a deluge of interest, but we also knew that we had more confidence in our vaccine supply coming through, that we'll be able to have more and more appointments. So rather than doing it piecemeal, we thought with the volume of vaccines coming through, the number of partnerships we've made with Kaiser, with La Clinica, with Lifelong, with private provider groups, with John Muir, we knew we had the partnerships and the doses in place to really get the vaccine out to our community.
Or it's also the structure that the governor laid out.
That's right, and it's also the structure that the government laid out, that after the 50 and over, the next group would be the 16 plus.
So with regards to the dosing, I thought after you guys did, you got something like 83,000, which was 30,000 more than the previous week. So you guys have obviously a plethora of active doses, while you've got other counties in nearby Santa Clara and others that are struggling to get what they want. Is there any sort of thought or concern about giving over some of these doses that you maybe can't use every week?
We're not in a place where we have any unused doses or wasted doses. We do know that every county is different, and they're all actually increasing the vaccine availability. Many of the counties, our neighboring counties, are tapping into the same federal and state sources of vaccine that we have been able to tap into. So I expect you will see supply of appointments increasing throughout the Bay Area in the coming days and weeks. Kids 16 and 17 can only get the Pfizer vaccine, and they do need their parents' approval. That can be done in writing or verbally. It was 1 million doses by Memorial Day, and we think we will meet that sooner. That's right.
What's your reaction to that study that shows that the vaccine is safe and effective for children?
I'm very pleased to read that news this morning that the vaccine is, the Pfizer vaccine seems to be safe and effective for 12 to 15-year-olds. We're waiting to look at the actual data, and the FDA will do that. And once they approve the vaccine, expecting that they do, we will be happy to vaccinate that age group as well.
Hey, Doctor, I'm going to have Dr. Guillon answer that question as well, please.
Yeah. Actually, to be honest, it wasn't completely surprising because we know that that younger group does fairly well. There are some rare complications with the COVID disease itself. But 12 to 16, 100% is just absolutely amazing. I'm hoping personally that it gets approved relatively quickly. We can start over the summer and get kids vaccinated so that schools in September, August and September will just be at full strength. I'm really hoping for that.
All right, thank you. So quickly, again, we're going to follow Brittany, and everybody who's on my team, raise your hand if you can help. So Will and Jackie will help to talk to people in their cars as they come forward, and Brittany will show you where to go. So you'll have opportunity to take B-roll and still photos down there. If you want to talk to people more in depth, it's really important that we not hold up the process. So if you can talk somebody into polling in here and you want to come and do a one-on-one with them, this space will be available for that, but please don't do that.
We've been listening in on a press conference in Concord. Hurricane Harbor out there is now being used as a mass vaccination site. Hurricane Harbor obviously is being shut down due to this operation. We do have Chronon's Charles Clifford. He's at this vaccination site and he will bring us more throughout the day. But happening tomorrow, everyone.